There are a million places to go for cardiology services in San Antonio and around Texas. The reason to go to UT Health is they are that unique combination of really good at what they do, but with a compassion as well as a passion, so that when you're there as a patient, you feel it, you sense it. They really have a sense of taking care of their folks.
We've really figured out how important it is to have team. If it weren't for the great staff at University Health System, nurses, pharmacists, case managers, social workers, anesthesiologists, respiratory therapists, everybody that comes together to take care of a child or an adult, we really couldn't provide the kind of care we have.
It was just so seamless, and everybody was so professional, and just from the time that they admitted me to the time I left, it was really an amazing experience, and I would go back to University Hospital on a heartbeat. I guess you can say that. In a heartbeat, I'd go.
Only 40 years ago, if you had a heart attack, we had no treatments. We could not open up the artery. We could not unblock that artery. You were in the hospital for 6 weeks. Your risk of dying was 1 in 4. Today, due to balloon angioplasty, the techniques, and the stent with Julio Pomaz developed here, your risk of dying from a heart attack is under 3%. 97 out of 100% of patients live, and you go home in 2 or 3 days. What a remarkable transformation in just 40 years.
The management of heart disease in women is very unique, and I also tend to emphasize that women are not little men. Women are different than men. It's not just the way we look, but all the hormones that are behind that look, and we have to be knowledgeable about that when we make treatment plans. And unfortunately, up until recently, there weren't that many studies specifically focusing on women with coronary artery disease. In the last 10-15 years, more and more of that is surfacing, and we are reshaping of how we treat women with heart disease.
I wanted to be a cardiologist because cardiology has affected my life personally. My father had an MI at the age of 49. My grandfather died from heart disease. My family, like many other families, have been affected by heart disease, and there's still much that we need to learn to help them become healthier and live longer.
When I had my heart attack, it likely could have ended very badly. And the fact of the way they responded and how nimble they were just in getting me in and out, and how thoughtful they were about just making sure that I really knew what was going on, priceless, absolutely priceless.